Jazzcast Pros. Welcome to the Healthy Illness Podcast. I am your host, Kelly Marie. The Healthy Illness Podcast is all about learning how to have healthy relationships while living with mental health conditions. By the end of our time together today, you will have 5 top questions to ask your doula that you are interviewing for doula services. So if you have been catching up on episodes or tuned in last week, I gave you a list of about 25 or so questions to ask doulas in the interview stage. I understand that was a lot. And so I hear you. I get it. I'm going to give you 5 questions along with why those 5 are so important to ask as you go on this childbearing experience and journey. You know, I have become a doula in the last few months and have been taking lots of classes and trainings and readings and shadowing and assisting and learning and coaching and really pouring all of my time into this doula work. And so we've talked about what doulas are, how they operate. Doulas are your labor partner, not your relationship partner, but your labor partner and coach, providing you emotional support, coaching support, like technical support in the moment, there with you and your partner and birthing team, both your medical birthing team and your familial birthing team. So your friends and family that are there to assist you during this incredible journey of childbirth. And so doulas have been around since people have been given birth. Doula life, doula work is not new. Over the last couple of decades, it has begun to make a resurgence. You know, once hospitals were on the scene and medical providers and nurses, you know, they were going to school. It became more of a traditional, formalized educational process. The work of doulas and the work of midwives diminished in many cultures. And so we are seeing a resurgence of doulas and midwives, and those are 2 different types of providers in recent years. There's been a lot of research that has been done on the impact of having a doula in the birthing room with the family, working with the birthing parent during the birthing experience. And so that is the work that I do in addition to mental health work and being a mindfulness and wellness coach. I wear a couple of hats. You know, there's also the day job that we don't talk about much here, but I have been drawn to this work. And so it was really important for me to break down all of the components of doula work and doula life so that you have a better understanding of what doulas are, how they function in your experience and in the actual labor delivery experience. So not just pregnancy, but labor delivery, postpartum work, all of that. So we've covered a lot of that over the last couple of episodes, and I'm going to bring a couple of doulas onto the show so you can hear from more than just me, in my opinion, about doula work. But I want to get to these top 5 questions. Big shout out to Jazzy T and Jazzcast Pros Network, all of the hosts of podcasts on the network. If you are looking for a place to pour into yourself, to learn more about you and how to be the type of person that's showing up in all of the spaces that you occupy in the way that you want to show up, listen, there's a podcast for that. Check out all of the podcasts on Jazzcast Pros Network. I guarantee you there will be another besides Healthy Illness Podcast that I think will speak to you. So peace, love, and blessings and all of the good things to the other podcast hosts on the network. So our top 5 questions to ask your doulas, plural, that you're interviewing for your doula position on your healthcare team. Let me just give you the 5 questions and I'm going to go back and break down each one. So question number 1, please tell me about your training and experience as a doula? Question number 2, what services do you provide and how much do they cost? Like, what do your packages include? Question 3, do you work with people like me? Question number 4, when do you show up once labor begins? And question number 5, what happens if you're not available for my labor? So those are the 5 questions right there. I'm going to tell you why each of those is important. The first one, please tell me about your training and experience as a doula. Why is that the number one question? And why is it necessary? Listen, if you don't ask any other question, that is the question you want to ask. Being a doula and doula work is an unregulated field, meaning there are no requirements for education or experience to become a doula. You could just wake up one day and say, today I'm a doula. That being said, most doulas have some training, education, and experience in this work, which is why they are professional doulas. In New York State, where I am located, being a doula is not regulated. However, what is regulated is accepting Medicaid insurance. And Medicaid is the only, and Medicaid and managed care organizations are the only ones in New York State that are paying from a health insurance standpoint. All other doula work is private pay by the client to the doula. In order to be a New York State Medicaid provider, of which I have met those requirements, you have to have education in anatomy, in labor and delivery, in lactation education, in childbirth education. I am CPR certified in both adult and youth CPR. We take comfort measure training. We have to be HIPAA compliant. We have to have liability insurance like that. Those are the minimum qualifications, minimum education that you have to have. You also have to have shadowed at least 3 births, and not just birth, but births and the pregnancy process for 3 clients. And that is, again, just the minimum qualifications for New York State in order to be Medicaid certified and be able to accept Medicaid managed care insurance through New York State. That is going to differ depending upon what state you're in. Not every state's Medicaid program accepts doula services as a reimbursable service. In the states that do, those requirements are going to be different. So I gave you what is required in New York State. Again, every state is different. Very few have requirements for Medicaid because you accept Medicaid. All the other states, it is not regulated as a field. And so if I chose not to be a Medicaid provider, I wouldn't have to have any of those requirements. So again, that's anatomy. You have to know the body, right? And know what's happening when and where, the names of all the parts, right? To be able to assist and function as a doula, giving pregnancy support and also labor and delivery support. You have to have labor and delivery education. You have to have lactation education, childbirth education, CPR certification for adults and infants, comfort measures training, HIPAA compliance, liability insurance, and additionally, for me and the doulas in my training program, which we'll talk about when we have Shannon Johns on the show. We also have acupressure training. I am mental health first aid certified in both youth and adults. And so there is a lot of education and training that goes into ensuring that doulas, at least those that are Medicaid certified and able to accept Medicaid, have a certain level of education and training and experience in order to be able to accept clients. Additional trainings are incredibly important. And so I would not, in my opinion, just settle for someone who has the bare minimum. There's nothing wrong with the bare minimum. And again, that's why you want to ask these questions. But there are so many other continuing education credits, conferences, trainings, and work that is done in maternal health and birthing support that helps a doula provide the best service that they can for their clients. So the second question, what services do you provide and how much do they cost? So if you are, again, in New York State and you have Medicaid, Medicaid will cover the cost of your doula services. For the rest of the folks that are pregnant, looking to be pregnant, and want to have a doula, those folks can pay out of pocket. Pricing will vary depending upon the doula and their experience and the services that they provide for the client. Doulas may have different packages. How many sessions are included? Are there different types of sessions with different packages? Like, you want to know what it is the doula is offering and how much those services are going to cost you. What is the payment plan, right? Like, you want to ask those questions around money, and you want to ask that up front so you know exactly what you're getting, you know exactly what to expect, and you know exactly how much you're paying for the services that you're going to receive. So that's question number 2. Question number 3, do you work with people like me? What does that mean, Kelly Marie? You have to know yourself, right? And you have to know what you need. And so I'm not talking only about culture and religion, but gender, sexuality, beliefs around medication, birthing centers versus hospital deliveries. Like, you have to know who you are. Does someone need to tell you something 5 times in order for you to get it? Do you get it once and you're done? Do you learn by reading? You know, do you need in-person services? Is virtual okay? Like, you have to know you in order to ask, do you work with people like me? I'm a Black woman, right? So there are some differences, disparities in health outcomes as it relates to Black women and childbirth and postpartum. I need you to know that if you're going to be, right, taking care of me in one of my most vulnerable places and spaces that you really can ever be in life. And so there is nothing wrong asking that question. This is your body. This is your experience. And you want to make sure that you're hiring or engaging the person that is going to best help you and support you during this journey. So don't be afraid to ask, and don't be afraid to advocate. Don't be afraid to tell that person who you are, right? In order to know if they can meet you where you are. This isn't about you meeting the doula where they are. The doula needs to be able to meet you where you are. So think about who you are, what you need. Maybe, beliefs that you didn't think were important, but now that you're, in this space and thinking about bringing another life into the world, like, what does that mean for you? And what type of support do you need? Question number 4. When does the doula show up once labor begins? So there are several stages and phases of labor. And we may get into that in, one of the podcasts down the road, but you need to know at what point the doula is showing up to assist you in the birthing process. How far away is the doula? Do they have a guarantee to be at the birthing center or your home or the hospital within a certain amount of time? You don't want to be in a situation where you are, in labor, you are at the birthing center, you're at the hospital, you let your doula know, and they're 3 hours away. And you've known that they're 3 hours away the entire time, and they don't have enough time to get to you, right? So it's important to know what point you should be expecting them in your space and place during actual labor and what that looks like. Again, don't be afraid to ask those questions, and don't be afraid to dive a little bit deeper. If the answer you get isn't sufficient, you can say, can you tell me a little more about that? That does not count as one of the questions. That was an add-on, a little bonus question right there. Can you tell me a little bit more about that? You can use that for all of the questions. And then our last question, what happens if you're not able to show up for my labor? So here's how we work, how we've been trained, and how I've been implementing my practice. I do not take clients, or I do not travel or schedule travel 2 weeks before or 2 weeks after a scheduled due date. So if I need to travel, want to take a vacation, I need to build my schedule so that I'm only taking clients that will deliver no later than 2 weeks before my vacation. So most doulas have that kind of schedule, but you need to ask. Again, remember, this work is not regulated by like a state governing board, or there are national and international organizations that certify doulas. And that goes back to that training question. You can ask them, do they have additional certifications? But it's not a requirement. And so because it's not a requirement, I mean, it's a bad look, and it's absolutely horrible for someone to tell a pregnant person that I went out of town and I knew that you were, due tomorrow, but I decided to, go on a trip 5 hours away, and I'm not going to be able to be there for your birth, right? Like, you also need to have that conversation up front. Most doulas have a backup doula. I have a backup doula, and also am the backup for a different doula, right? So I am me in the backup. For me, I am not that person's backup, because then it's just the two of us. Like, you need somebody else in that mix to be able to provide coverage. And so we work together to ensure that there is coverage in the case of an emergency. Again, that's for emergency purposes. Perhaps 2 clients are in labor at the same time at different hospitals, or something happens in the life of the doula. Again, I talked about this a little bit last week, but something big comes up, right? Not like birthday dinner or girls' night or weekend trip or getaway. That stuff you plan and is secondary to your client and this life as a doula. And that's something that we, again, not regulated, but when you talk to your doula that you're interviewing, you can have this conversation. But that's something that I believe in as a doula. That is something that my mentor believes in as a doula and has instilled in me as a doula, is you show up. You need to be able to leave work. You need to be able to leave the family. You need to be able to be there for your client and their family for their delivery. Have that conversation. Ask those questions. It is your absolute right to know what happens in case the person you have paid to provide a service is not available when you need them. So those are the 5 questions. And you can, again, can you tell me a little bit more about that? If they don't quite answer, or you need a little more information, open the door, right? You're having a conversation. It is an interview. They are getting to know you, and you're getting to know them. You not meshing well is not an insult to either person. You want to be with the person that can coach you the best during this experience, can provide the best experience for you based upon what you want. And you know what? You might not even know what you want. So you need the type of doula in that case, right? That can help you work through all of that. There are doulas that do that. Again, these 5 questions are so important to me, in my opinion, as a doula, as a person that has given birth. I did not have doulas in my birthing experience with my children. And that's something that, looking back, I wish I had. Those experiences would have been so different had I known about doula services, had a doula, been there by my side to be able to coach me through the pregnancy and also through labor and delivery. And so those 5 questions before we wrap up. First one, please tell me about yourself and your training experience as a doula. What services do you provide? How much do they cost? What packages do you offer as a doula? Do you work with people like me? Again, you have to know yourself in order to know that the type of doula you need and if their answer resonates with you. When do you show up? Once the labor begins, right? You need to know when to expect the doula to arrive. Also, that communication piece, you need to be able to communicate to the doula to let them know what's happening in your stages and phases of labor. And the last question, what happens if you're not available? If something comes up, can you get to me, right? Like, what's the plan? So many things can be alleviated and addressed if it's talked about beforehand, if you lay out what things look like ahead of time, you have your support team and your medical team all on the same page. Life happens and things will take a turn. But if that happens in that instance, you've talked about what the expectations are and the type of experience that you want. And so your doula and the rest of your medical team can work to help you meet those goals. With that, I leave you with my every episode goodbye, be the light. And we're going to dive a little bit deeper, talking to two doulas, one that specializes in postpartum work and another that not only runs an incredible organization where I live, but is helping to change the landscape of maternal health and doula services for all people that are on this journey. I would love to know, and feel free to send an email to me, Kelly Marie. Email address is frontseatlife@gmail.com. I'd love to know if you've had a doula and what that experience was like for you. I'm so excited to be able to offer doula services to people in my area, and I look forward to sharing more of this space, more of this work with you as we learn to live a healthy lifestyle with mental health conditions, helping to bring other people into this world in the best experience possible. I am your host, Kelly Marie, the Healthy Illness Podcast. Until next week, I encourage you to be the light. Hey, if you are looking for services in your area, you don't quite know where to start, including doula services, right? You can dial 211 on your phone. You can go to 211 in your web browser, ask Siri or Alexa or Google, any of the AI folks, about services in your area by going to 211. It's a national network of service databases by zip code, city, geographic area. You can find the services you need. It's a good place to start to find the services that you need if you don't just know where to go. And if you need someone to talk to, I really am personally struggling with where we are, not just as a nation, but just as human beings in this time and space that we're in right now. And, this time might be difficult for you. If you're struggling, if you need someone to talk to, please dial 988. Someone is there 24 hours a day, 7 days a week to answer your call. 988 is the national talk line for suicide prevention and mental health crises. You don't have to actually be suicidal to call 988, right? So if you need someone to talk to, if you are having a tough go at life right now and just need an ear, call 988, 24 hours a day, 7 days a week, confidential and free. Again, big shout out to Jazzcast Pros Network. Thank you for listening and reaching out and letting me know that you are still there. I appreciate you so much for downloading, for listening, for liking, for sharing, and for subscribing. Until next week, be the light.